Hello, I'm Tian Wei, and this is World Insight. We begin with the World Health Organization's opening its annual World Health Assembly. The virtual forum will run from May the 24th to June the 1st. This year's session stresses the urgency of ending the current pandemic and preventing the next one by building a healthier, safer, and fairer world. Since the pandemic broke out, there have been more than 166 million confirmed cases of COVID-19, including more than 3.4 million deaths. The pandemic is far from over, and the global response is at a critical phase, with vaccine inequality being one of the most urgent issues. Addressing the opening World Health Assembly on Monday, the UN Secretary-General Antonio Guterres said that the world is, quote, at war against COVID-19, and he called on world leaders to take bold decisions, quote unquote, to end the global pandemic spreading and mutating in poorer countries. Heads of state and governments and special guests around the world participated in Monday's high-level segment. So how can the world unite? Well, will it unite in fighting the pandemic? How to reform and strengthen the WHO and the global health system? Let's loop in our panelists. In Washington, D.C., Kate Tulenko, CEO of Corvus Health. In Seattle, Dr. Alice Kim Kyung-tan, internist at the Ms. Medi Women's Hospital from South Korea. And in Beijing, last but not least, Ding Sheng, Institute Director of the Global Health Drug Discovery Institute and the Dean of the School of Pharmaceutical Sciences from Tsinghua University. Ladies and gentlemen, welcome to the program. Now, several things being mentioned at the World Health Assembly. Lack of preparedness against global pandemic and the vaccine inequality are just some of those topics. First of all, why are we so much lack of preparedness? After all, we've already had some similar pandemics 100 years ago, and if you think about it, even SARS more than 10 years ago. What really happened? What is wrong with us, with our system? Dr. Tulenko.
I think there are a number of things going wrong. So in 2005, most countries in the world signed the International Health Regulations, which was a binding agreement to help prevent pandemics. And since then, 5 pandemics have been declared. And the problem is, even though that WHO declared a pandemic at the end of January, it wasn't until mid-March that most countries responded by doing lockdowns. And so it's thought now that we need a different international contract that has a little bit more teeth in it, so that when pandemics or outbreaks are declared, that the countries respond much faster.
So you talk about the enforcement of policies, particularly related to possible pandemic, whether it's at local level or national level, the efficiency of implementing. Dr. Tan, what do you make of what is going on wrong with the current approach and the current system?
Right. The current approach, when this all broke out, I would say it was too little, too slow, and too late. Pandemic response needed to be a priority on everyone's national agenda, and it wasn't. There needed to be coordinated all-of-government responses, and there wasn't in many cases. And of course, the funding for the WHO was inadequate, and it still is. And so they're just on so many levels, the WHO level, on a global level, and each country-wide level, there were so many deficiencies. And as the independent panel has stated, every chain, every link in the chain had deficiencies and weaknesses, and they all need to be strengthened in order to prevent the next pandemic.
Dr. Dean, your take.
I would say actually, first, really, I mean, we have not faced such pandemic for many, many years. Even in the past 20 years, there were a few of such viral outbreak, but it hadn't really reached such unprecedented level. Certainly, I think no one has really prepared for this scale of viral pandemic situation. Secondly, I really agree with other panelists. This really would require a global coordination. And again, what we've seen since last year is really there's much less coordination between different countries. And even within each country, perhaps there's less desirable coordination between different regions. And again, I think what we've seen so far is really people have to relearn lessons and lessons again.
Okay.
So certainly all of those has to be really improved.
Several fronts we can learn the lesson, right? And see whether we really learned the lesson. First of all is when the third wave, commonly known as the third wave now, hit the world, whether countries and also localities are prepared and be able to implement and enforce. Second, of course, it's about the vaccines. We see now there's an ongoing process. Inequality of vaccines is not a secret. Most of the countries in the world do not have most of the jabs, and yet 10 countries in the world have almost the majority of the inoculations so far. Dr. Ding, from China's perspective, how do you see that?
I think actually from the very beginning, there have been actually a lot of discussions in terms of how vaccines could be developed and later on distributed. And so far, I would say actually we actually have been really successful in terms of developing the vaccine and also in the early phase of vaccination in certain regions. But again, it's not uncommon actually, manufacturing of vaccine need to be scaled. Certainly distributing acquisition and the distribution of those vaccines to other countries actually has to be practically staged. So I think actually we all have to really again learn from this process and really improve on the equality situation.
Dr. Tulenko, the U.S. Inoculation process seems to be going quite well so far. We see quite a number, the huge population of the U.S. Be able to be protected so far as the numbers indicate. But what about the global governance and the U.S. role so far?
Well, I think it's important to look at it from another angle. So, for example, the UK bought 5 times more vaccines than it would need to cover its population. The US also purchased more vaccines than it would need. And there actually are 3 advantages to doing something like this. It's not necessarily vaccine nationalism. One, when countries make these large purchases, a country like the US and the UK, they can sign the contracts faster. They're trusted partners. The pharmaceutical companies have dealt with them before, and they'll work with them quite quickly. So that's one thing. 2 is this is basically creating an advanced market commitment. That one of the big problems and main barriers that pharmaceutical companies don't make more vaccines or they don't make drugs for a lot of tropical diseases is because they don't think there'll be a market. No one will buy them. But when the UK comes and says, I will buy 5 times the number of doses I need for my population, that creates a market. And the pharmaceutical companies know that someone will buy their vaccine. Yeah. And then the third reason that this sort of overbuying can be good is it prevents you from putting all your eggs in one basket. So if the UK had just invested in AstraZeneca's vaccine and that vaccine didn't work, they would have been in trouble. They would have been out of luck. But by investing and purchasing multiple vaccines, they were able to both protect themselves more and protect others more. But I think the issue of vaccine nationalism perhaps can be defined as countries vaccinating their low-risk citizens before other countries are able to vaccinate their high-risk citizens. High risk being defined as either for health reasons or for job reasons, for example, being a frontline health worker or if you're a refugee or in a crowded refugee camp. Yeah. So I think that's perhaps the best way to define vaccine nationalism.
In that regard, how to look at the U.S.?
then under that that definition, then the U.S. would be considered to be doing vaccine nationalism, because pretty much anyone in the U.S. can get a vaccine now as a walk-in. You don't even need an appointment. But the U.S. has now committed the rest of the vaccines to other countries. So I think we're seeing that move. And remember, it was only in late December that vaccinations started for COVID. And even if we're able to produce in the next year enough vaccines to vaccinate all 9 billion people in the world, it's going to come out incrementally. So the world needs to develop a way to prioritize who gets the vaccine.
Yeah.
So perhaps it would be countries with large outbreaks like India or Brazil, or it'll be countries that have large number of vulnerable people, either large numbers of elderly or large number of internally displaced people.
Right. Dr. Tulenko gave us quite a clear analysis from the U.S. perspective, but I can tell through the answers there's a lot of economics in terms of why the purchasing can be fast, why to buy in such a huge amount, and why it is possible to encourage as a result the pharmaceutical companies. But besides the economics, in a pandemic, there are many other things that people should think about. For example, human lives. Maybe that's an option and an important point. And how to make sure the most dangerous population, as Dr. Tulenko just mentioned, will be inoculated first, so that the overall global risk of a further development of the pandemic will be hindered. That is the key here. Dr. Tan, on that point, how do you see the current situation? What is the problem here?
Well, you know, in January, I would say that the situation looked fairly bleak in terms of equitable vaccine distribution. However, in the month of May alone, let's just take a look at what happened. At the Global Health Summit, Pfizer pledged 1 billion doses of their vaccine to low and middle income countries. Johnson & Johnson pledged 200 million doses. Moderna pledged 100 million doses. Earlier this month, Novavax pledged 350 million doses to the COVAX facility. The United States also, prior to the Global Health Summit, pledged 80 million doses of vaccine to be donated. And so within just a few weeks, within this month of May, we've really turned, I think, the tide in terms of trying to achieve the COVAX goal of delivering 2 billion doses of COVID-19 vaccines by the end of the year. If all of these vaccines, so far COVAX has delivered 69 million doses, that's as of May 21st. So if all of these pledges are kept and they are all delivered by the end of 2021, we will have achieved and even exceeded COVAX's initial goal. Of course, that will not be enough to end the pandemic by any means, and so that's why the independent panel has recommended that another 2 billion doses be pledged in 2022. And fortunately, Pfizer has also stepped up, and they said that they would donate or make available another 1 billion doses in the first half of 2022. So right now, I think we are in a much better position. However, it did take a lot of effort. Dr. Tedros had to plead, really. He wrote that op-ed in the New York Times, really criticizing nations for what was happening and raising the alarm signals, because as you said, if we do not have equitable distribution, it will just prolong the pandemic, it will cause unnecessarily more deaths, and also it will cost the world much more money in the long run.
I'm a journalist.
And so I do think
Dr.
we are
Tan,
in a better position now.
I'm a journalist. I want to be optimistic, but I cannot be optimistic. That's the nature of my job, right? I need to be critical because I want to ask one critical thing you just said. If it is being implemented, if the promises are being carried out. We saw COVAX earlier running into huge crisis because of some of the manufacturings of vaccines were not possible due to the latest sad situation in India. So how can we make sure all of these pledges will be in place? And by the way, even COVAX is working 100% as it promised. Only 30% of the world population by the end of this year will be able to have access to vaccine. That is, according to the current knowledge, it is still much lower than the kinds of protection we need for our global population. And the most vulnerable countries are showing their most vulnerable points. India is one of those examples. And something going on there, we're going to spread to the rest of the world. This is just the nature of the pandemic. So Dr. Tan, I can't be optimistic, even though I want to sing an ode to all the pledges, but it's not possible, Dr. Tan.
Well, certainly, when a country implements an export ban, I think that is another example of vaccine nationalism that is really working against the global goal and effort. However, if we look at what has been delivered so far, what the vaccine companies have been able to do, and also we talked about before the importance, in my opinion, of contract manufacturing of vaccines. Just 2 days ago, Moderna signed an MOU with South Korea and Samsung Biologics to contract manufacture the mRNA vaccine in South Korea. So companies are making efforts to scale up production. The EU, they pledged $1.2 billion to help with vaccine manufacturing in Africa. Countries, I think, are realizing that we really are in one boat, and it's either we all sink or we all survive. Yeah. And so I don't share your complete pessimism. I understand the concern, however.
Dr. Ding, earlier the other two guests have already talked about where, how much commitment the countries that they are in are committing to this. I guess in China's case, it's not short of actions either, and probably even more. Tell us more about what China has been doing, and should we be optimistic about China's role in the future in terms of making sure that it's not going to be as much vaccine nationalism as it used to be, we have seen over the past year in the world?
Yeah, that's really an excellent question. Certainly, early on, China joined COVAX to really pledge a commitment to really supply, especially developing country, China's vaccine. And certainly more recently, the inactivated vaccine by Sinopharm actually was approved by WHO. Certainly, this would meet the COVAX commitment requirement. So over the last year, by our central government as well as by actually the manufacturers, making that commitment actually it's being delivered. And again, China being one of the leading countries in terms of fighting COVID-19 in the front of vaccine development, antiviral, for example, antibody development. A lot of those efforts actually are really towards actually certainly China self as well as the rest of the world.
I understand over the past 7 days, that's the latest number I got here, from 400 million to 500 million, just 100 million doses, jabs of vaccines have been inoculated in China over the past 7 days. So of course that's a China speed in a way, but whether the population here in China are fully aware that the role they play, the responsibilities they have in having the vaccines, so that it will make sure this huge part of the population will be safe for the rest of the world to fight against the pandemic. Dr. Ding, I think that's a very urgent question for China to answer.
Certainly, again, China in the past year has been very active in terms of developing the vaccine. Again, two of those type actually were already approved and also already being deployed. And actually a few more is being sort of a trial in the late stage, phase 3 trial, I think will be available in the coming months. Again, in the early days, rolling out the vaccination program had been slow, but in the recent few months, actually, really, the speed has been picking up. Certainly, vaccinating, the largest population in the world, in China, actually, is really important, as actually the whole world is really opening up the traveling, economies.
Right, to a certain extent.
So again, focusing on China, it's actually really important.
Okay. We also see other issues related to the World Health Assembly, such as the independence, the transparency, and the funding issue of WHO. And will WHO be able to play a role in investigating about the global pandemic? And to what extent can they play that role? How will member countries contribute to that process? And how will that relate to the overall UN reform, the overall geopolitics? Well, and the list of questions goes on and on. Even though it's only a meeting of about 7 to 10 days, we're going to see a lot of heated debate over there. And I'm sure we're going to pick up some of those debates later in our program as well. For now, I want to thank the three of you contributing to our conversation. Kate Tulenko and Dr. King Kyung Tan and Dr. We also have from China, Dr. Ding Sheng. Thank you so much for joining us. Thank you.